Thank you, and I want to thank you all for being here. Often it's said that we're the home of the free because of the brave, and certainly our minds go to our soldiers and veterans when we hear that, and rightfully so. But as I've traveled my district in the country, I often remind people that we only save our nation when everybody in every walk of life stands up and is courageous. And so I want to thank you for being here in spite of some of the concerns that have been mentioned that's going on with doctors being ostracized and losing licenses and all those different kind of things. I'm concerned about a trend that we've seen recently in healthcare where we go from America being the envy of the world when it comes to healthcare system, bringing innovations to the world, doing all these different kind of things. And sure, it's not a perfect system, but we certainly led the world in it to where we've seen recently a kind of massive consolidation of power, and then that has also been a part of this separation between the doctor and patient. Obamacare being a big part of this, and to where we see more people on health insurance rolls and less people actually getting health care. And so it was great for the profits of the health insurance companies, not so great for the patient. And then COVID pandemic and our response to it, exacerbating that in a sense. And you've touched on a number of those things in the past, but truly the pandemic made this situation worse. We saw people silenced, we saw people dissented. I know of public health officials that were out there spouting the CDC official lines, but then had a closet full of hydroxychloroquine or ivermectin for their own patients. I know of pharmacists that's been mentioned that wouldn't fill doctor prescriptions. I was in much of my district's role, and there were hospitals that stopped doing surgeries even though there's not one single case of COVID in their district. Even here in the House physician sent out a memo giving fines for people not wearing masks, but it was just for the House. So you could literally be in the rotunda and subject to a fine for not wearing a mask on one half of the rotunda, take 2 steps over in the same room and be totally clear, even though, and how shall I put this, the demographic profile of the Senate was more vulnerable to COVID. And so this whole thing's really been bizarre, and it's caused a massive distrust from the American people when it comes to what they should expect out of it. And a lot of this consolidation of power is termed in these nice terms like consensus, which is actually a good thing, population-based or community-based healthcare as opposed to focusing on the individual in front of the doctor. And you all have given great testimony. Dr. Khatibi, I wanted to talk to you because I was interested in how you talked about consensus, and also especially you being an immigrant from authoritarian regime. I find it interesting that when I travel, many immigrants actually understand and are more concerned even than people who've been kind of in the boiling pot of what's happening in America, kind of a frog in the boiling pot. They see what's happening when it comes to some of these concerns. And I was wondering if you could speak to some of that and your concerns about that, and especially maybe why this is happening. What do you think is behind all of this?
Well, let me start off with the why. I think that as a consciousness in the United States, we're still very much in a reactive way of behaving, and we certainly saw that during COVID. People, instead of being wisely, mindfully responsive, they're just reactive. They other. They don't listen. We've seen that here, and what happens is then people don't stop. They stop thinking and they start trying to kind of focus on ego-based protective mechanisms that then actually prevent you from thinking cognitively. And the people who've had experience living in authoritarian regimes have seen it, so they have more access to that cognitive experience, or because they've lived it, and so they can connect the dots more easily than someone who's just living in fight or flight and being reactive. So they recognize these patterns of chilling of speech, everybody kind of in a group think, the government pressuring for censorship or suspecting it, or and noticing that there's pressure from the government. They notice these things better, easier. And so I've certainly seen that in my immigrant community, that people are more wary of the American government now. And I think people are waking up a little bit and seeing what happened during COVID. People who disagreed with me a few years ago are agreeing now. What was the first part of your question?
I don't recall. Dr. Singer, you talked a lot about the cash incentive involved in it, and it seems like there's kind of almost a carrot and a stick to this in the sense that the federal dollars flowing into the system in ways have kind of messed up the incentive structure of honest feedback. And it seems also, in a sense, there's also the legal recourse in that a lot of people, like the CDC, who come out and just say, oh, it's a recommendation, but unspokenly, if you don't follow it, that you open yourself up to lawsuit abuse. Meanwhile, you have these massive companies that have kind of protected from liability, specifically in the case of vaccines. I was wondering if you could speak to a little more to your concerns in that regard.
Well, Representative Cloud, it's a very good point. In fact, it's not limited just to the coronavirus pandemic. In general, when government agencies recommend things, it oftentimes becomes a de facto mandate because either because of the government agency being a source of funding, or maybe having regulatory oversight that could be detrimental to the entities that is making recommendations to it. So I jokingly say that when the CDC recommends something, it's oftentimes like when Tony Soprano recommends something. So your point is well taken, and that I think that contributes to. I think it's just a natural phenomenon of the way it is when government gets involved in these things. I think it's unavoidable, but that contributes to a creation of distrust between the patient and the doctor, because especially with the experience we've had where there was constant changing of different recommendations, which is understandable because the information was changing, so these recommendations had to be revised. Patients started wondering, are you, doctor, recommending this to me because you really believe this is what you think I should do, or are you recommending this to me because you're afraid you'll get in trouble if you don't recommend this to me? And that's not a healthy relationship between the patient and the doctor.
Thank you, Chairman. I'll yield back.